What's going on, everyone? Happy Monday. Happy Martin Luther King Day to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Monday edition of the Pandemic Update for Monday, January 15th, 2024. What is the Pandemic Update? The Pandemic Update is not just about COVID. It is where we talk about all the different viruses circulating in the world. There's not many people that do this on a daily basis, so I thought, hey, why not start up a daily Pandemic Update? We've been doing this now since the summer of 2022, and here we are. So if this is something that you want to learn more about, or you like seeing, give the video a thumbs up and subscribe to my channel down below. Today being a holiday, we do not have a lot of states in, but we do actually have more things than I expected, which includes Walgreens. Walgreens did update today. As far as I know, New York State has not done an update yet, but I will keep refreshing it to see if there is one as we go along here. So starting off, let's do a few news stories first. Anyone remembered the TV show? It was a soap opera, All My Children. My grandmother watched it as a kid. I'm sure you had someone that watched soap operas when you were growing up back in the day. It was a big thing back in the day, and there still are a few soap operas out there. All My Children no longer airs. However, one of the actors from the show, Alec Muster, has died at 50 years old. His fiancée suspects COVID was a contributing factor, and it does say here, Muster had been suffering a severe case of COVID. This is not the first time an actor has died. There have been musicians that have died. Just last year, David Crosby died of long COVID complications. His wife actually said no, long COVID probably contributed to his death. So it's happened before, and unfortunately it's going to continue happening. More on deaths in just a little bit when we get to the weekly numbers from BNO. Trust me, you want to stay tuned. They're not good numbers this week. They're really bad. Okay. This is an interesting story. How common is long COVID in North Dakota? Well, we're not going to just see about North Dakota here, but we do see states that rank in terms of long COVID. And take a look here. Number one, we've said this before. It's been a while since we said this. The number one state for percent of long COVID cases is Oklahoma at 34.1%. Then comes Montana, which is ranked number 2 at 33.8%. Number 3 is Alabama at 31.7%. Number 4 is Arkansas at 30.8%. Number 5, North Dakota at 30.6%. Ohio is at 30%, which is number 6. Wyoming comes in 7th place at 29.7%. Then comes South Dakota at 29.5% at 8th place. Number 9 would be West Virginia at 29.4%. Indiana is 10th place at 28.7%. And the national average is 24.4%. Those are your top 10 states for long COVID. So, yes, that is not good. Those are the percent of long COVID cases. But then they also do the percent of adults with long COVID symptoms that have reduced their ability to carry out daily activities. And look at this. Number 1 is Hawaii at 50.8%. Yes, the 58. So half the people with long COVID in Hawaii can't carry out their daily activities. Mississippi, number 2 at 44.6%. Number 3 is Oregon at 41.5%. Number 4 is Georgia at 39.2%. Number 5 is Louisiana at 37.9%. Number 6, California. Number 7 is Maine. Number 8 is New Hampshire. Number 9, North Dakota. And number 10, Washington, D.C., which is at 34.8%. And the national average for percent of people with long COVID who cannot carry out their daily activities is 31.1%. So a lot of people say, why is disability claims going up? Blah, blah, blah. Why are people so lazy nowadays? Start thinking about long COVID, because long COVID is a big contributing factor. It's now up to 31.1% of all people with long COVID can't carry out their daily activities. And remember, the national average of percent of people who now suffer with long COVID, who have had COVID, cases that have gone on, is at 24.4%. That's millions of people. These are millions of people that did not have illness, or potentially did not have illness before COVID came around. So, yeah, long COVID, my friends, it's a big deal. We probably could have done this as a whole video itself, but I figured let's just add it into today's pandemic update. All right, we have to switch gears here completely. We have to go over to the UK. So remember, here in the United States, we've been talking about measles from time to time. It seems to be we're talking about it more and more now. Well, children's hospitals are inundated with measles cases. This is over in the UK. Birmingham Children's Hospital has been dealing with measles cases with the highest number in decades, and this is not good. It comes as UK Health Secretary Agency figures show West Midlands had at least 167 laboratory confirmed cases, with a further 88 cases likely. A low vaccination rate of about 5% has been attributed to the rise. So just thought I would update you of what's going on, and let's continue here. Across Europe, up to October last year, there were 30,000 confirmed cases, whereas the previous year there were just 941. Yeah, my friends, that's a big increase. So we're going to continue to watch what happens in the United States as well, because remember, with some of these viruses, what happens in Europe and the UK often is an indicator of what could happen in the United States. And there's already cases popping up here in the Philadelphia metro area. There was a case last year up in Maine. There's been some cases in Virginia popping up now. So yeah, it's something we have to watch. And we know from COVID, when cases of viruses start to increase, the chances of a virus mutating also increases. It's happened with Mpox. It happens with COVID. Could it happen with measles? I don't know. I'm just speculating. All right, continuing on. I promised I would do something on Arizona today. We haven't talked about Arizona in a while. Apologies, but to be fair, I haven't found much of anything on Arizona in a while. Respiratory viruses are still circulating widely in Arizona. Coming down here, it says respiratory viruses are circulating widely in Arizona. The Arizona Department of Health Services confirmed 3,094 influenza cases last week. Remember, this is 3 weeks old, so this could be from the prior week. Meanwhile, the state confirmed 1,437 RSV cases, which is more than 4 times higher than average. And for COVID, they're really out there. We have to go back to December of last year. COVID-19 is currently widespread too, with hospitalizations jumping 22% in the last week of December, according to the Centers for Disease Control and Prevention. So yes, COVID, RSV, and flu, it is circulating in Arizona. More of that in a moment. We're going to take a look at Walgreens in Arizona as well. All right, we have to get to the BNO numbers. My friends, it's not good. COVID for the past week, it actually went higher. New cases, 377,138. The average is 346,000. That's up by 25,000. 50 out of 50 states reporting. In the hospital, 29,595. That's up by 3,855. In the ICU, 2,824. That's up by 247. And this number I want you to pay really close attention to. And remember, new deaths of COVID, just COVID, 2,172. We will revisit that number in just a couple moments. Unfortunately, that number's going up. Deaths are the final lagging indicator. So with hospitalizations still going up, ICU still going up, that means deaths will only continue to go higher. And I think that's going to be the case through the end of this month. They probably will not start dropping until the beginning of February, or at some point in February they will definitely start dropping. Will it be a rapid drop? Hard to say. And it says here, to break down, the reports are from 22 states, estimates are from 28 states. COVID cases continue to rise in parts of the U.S., but may have peaked in some areas. New cases this week, nearly 380,000, are the highest so far this winter, excluding backlogs. During the past week, nearly 36,000 Americans were hospitalized with COVID. That's the highest since over a year ago. And yes, yet again, another week with 2,000 new deaths. Remember, there were 2,172 deaths. We're going to add that number now with what's going on with influenza. And here you go. Influenza. Yeah, not good. This is actually, I'm surprised how bad influenza is right now. Weekly U.S. influenza update. New cases. 4 million new flu cases in the last week. Average is 2.5 million. Hospital admissions, 40,000. Yes, there's actually more admissions for flu than there is COVID right now. Remember, COVID can mess up the immune system. New deaths, 2,900. So we'll take that 2,900. Let's enter that in here. 2,900. And we want to add that to the current COVID number, which was 2,172 deaths. And voila, you get 5,072 deaths in the last week just from COVID and flu, not including any potential RSV deaths or any other miscellaneous deaths. I know oftentimes COVID can lead to pneumonia, and that can be the cause of death. Flu can too, but I'm sure there's other deaths, and I'm sure this is an undercount because I have been seeing on Facebook and social media, unfortunately, a lot of people saying we're sad to announce so-and-so has passed away. A local restaurant around here, a bar-restaurant, I noticed in a community group, they have already had 2 deaths, one being a partial owner, one being one of their servers, have died this year. And we're only 15 days into the new year. So, again, 5,072 deaths in the past week just from COVID and flu alone. That is really bad. It's just not good. Let's take a look at what's going on with air quality for today, and then we will get over to Walgreens data. And we can see air quality across the country. A lot of people are using their fireplaces. It's cold in many areas. And you can see here, yes, bad air quality in the West Coast, moderate air quality in the central region and the east, and that's because of fireplaces. The south is not terrible, although we do note this. I do note Louisiana and Texas is seeing some poor air quality at this time. All right, let's skip over some of the CDC data because we do want to take a look at Walgreens. The national positivity rate is 27.5%. The prior week was 28.2%. That's down 0.7%. Walgreens has peaked at this time, and that's with testing down as well. 31,087 tests versus 36,550. Let's switch the view here. And, well, no, let's first take a look at some places that are rising. Vermont, 42.9%. Your testing's way down. That's why you're up 11.3%. 14 tests versus 38. Then we see Massachusetts, 38.5% positivity versus 30.5%. That's up 7.9%. Total test, 39 versus 95. Your testing dropped big time. New Mexico, positivity is 22.7%. Prior week was 17.8%. Positivity is up by 4.9% because 163 tests versus 197. All right, Arizona. Arizona, your positivity this week is 24.1%. The prior week was 29.6%. That is down by 5.6%. Total test, 756 versus 891. So this would indicate your cases may be falling because testing is down and the positivity is down at the same time. South Carolina, 24.8% versus 21.5%, difference of 3.3%. That is upwards because testing is down big time. 773 tests versus 1,079. I'm actually surprised South Carolina even does that much testing. Florida's doing a lot of testing. Florida's testing actually went up, but the positivity rate dropped. 28.4% this week, prior week 28.9%. Difference of down 0.5%. Total test, 4,330 versus 3,940. And I hate to bring politics into the equation, but that is really a surprise considering how heavily Republican Florida is. So I'm actually, surprised about that. California, 969 tests versus 965, which equals out to the positivity rate actually dropping to 29.2% versus 31.1%. Let's go to Illinois. 29.1% this week, 30.4% last week, down 1.3%, and testing is down as well. 1,900 versus 2,650, and we'll just do one more state. How about Oklahoma? We have not done much of Oklahoma in a long time. 24.5% this week versus 21.2% last week. That's a difference of up 3.3%. And your testing's also 359 versus 339, which indicates, yes, your cases are still rising. As we know, the JN.1 variant is currently the dominating variant in the United States, and it is well ahead of all the other variants. Taking a look now at Philadelphia for the past couple days. Saturday, 728 EMS incidents, and then taking a look at Sunday, 740 EMS incidents. Let's do a live looking at what's going on in the suburbs right now, and wow, there's actually only 5 EMS calls in Montgomery County right now. That is really low. That is a good thing to see. Can we continue that with Chester County? Actually a few more calls in Chester County, but again, not as bad as we have been seeing. I am seeing some respiratory and heart problem calls. That's never a good thing. New Jersey, not all hospitals reported. 63 versus 70. Hospitalizations, 1,174. Ventilators, 46 people on a ventilator, and in the ICU, there are 160 people in the ICU, and discharges at this time, 155. Let's refresh New York State. I don't suspect there will be an update there today, but now 5,632 cases on the most recent update. And when we take a look at hospitalizations, let's refresh this just to be sure that there's not an update. We're going to zoom this in. And when we take a look at this, we see it does say as of the 15th. So maybe there is a new number here. Yes, there is. 3,058 people in the hospital. Although I think that's the same number we read off on Saturday, even though it does say here, last updated on the 15th. The overall general idea here is New York State is dropping. We may see a rise tomorrow or Wednesday simply because often that is the case, that the biggest change often comes on a Tuesday or a Wednesday. This week possibly being a Wednesday because of the holiday. We do not have any other states that have come in today. In conclusion, we talked about long COVID earlier in this video. Yeah, that's concerning. The percents of cases that are dealing with, the percent of people who get COVID that are dealing with long COVID, and the percent of people that cannot do their daily function. Also, very concerning that we saw how many deaths there were in the past week just from COVID and flu. Again, 5,072. That is not a good number. It's likely an undercounted number. If we add in RSV or other things, it's probably over 6,000. So, and that's just in the United States. So again, not good data today. We're starting off the week on a bad note. I suspect we're going to continue the week on a bad note. We may see some states where cases start dropping, but the death wave, it is here to stay probably for the rest of the month before it starts dropping in February. Alrighty, folks, that does it for today's pandemic update. We will have another pandemic update again tomorrow. If you like this video, give it a thumbs up. If you're new to the channel, you enjoy seeing this, you want to see more of this, maybe you're glad that, wow, someone is still doing this, subscribe down below. And if you know anyone that needs to see this, share this with them. If you have anything to say, maybe you want to correct me on something because, I'm only human. I make errors sometimes. Or you're astonished by how many deaths there were or those long COVID figures. By all means, leave a comment down below. We will have another update again tomorrow. Until I see you again next time, stay safe, everyone, and have a fantastic Martin Luther King Day and a fantastic Monday evening. Thanks for watching.